If you're taking a beta blocker, this may or may not be appropriate for you. Now, what is an appropriate use of beta blockers? If you have heart failure, if you have high blood pressure, and you're tolerating the medication quite well, that might be fine. However, many people are put on beta blockers who do not have heart failure, and the reason they're put on them, and this might be you, is that you've complained to your doctor about arrhythmias of your heart or heart palpitations. Your heartbeat feels irregular. You can also get put on this medication because you have anxiety. That's considered an off-label use. So let's look at how these drugs work and if it's right for you and what might be actually the root cause underlying why you got put on this medication such that you don't need to take it anymore. Now, let's start with how it works. So the mechanism is that the drug slows down your heart rate and how hard your heart beats. And that can be very nice if you have heart failure because it's just basically giving your heart a break. And because it's pumping with less force, your blood pressure goes down. So those are the two key reasons I mentioned earlier why it could be very appropriate to be on this medication. Now, the thing that gets many people on this medication as sort of more of an off-label use is that they have shortness of breath, they have heart palpitations, as I mentioned earlier, the rhythm of the heart is off, and or they have anxiety. And these latter few symptoms fit into hiatal hernia syndrome, which is something we talk about quite a bit on this channel. So what can happen when you slow down the epinephrine or the adrenaline production, that slows down your heart. So on the face of it, you might say, okay, that's making me feel less anxious and that's reducing my heart palpitations. Fine, but all medications, as you know, have side effects. And what if we could get to the actual root cause of your heart palpitations and of your anxiety so you don't need to be taking a medication that is creating potentially other problems? Some of the side effects of these drugs are because they're lowering your blood pressure, and I definitely meet many patients, new patients who are on these medications who do not have high blood pressure. Now, the liability of that is that these medications can lower your blood pressure too much because you don't really have high blood pressure, and it's slowing down the heart so much that now you're dizzy, you're lightheaded if that happens while you're driving, or there's a lot of places in life that you don't want to be dizzy, lightheaded, or even pass out due to low blood pressure. That can be life-threatening. So there's that side effect. As far as, I want to just see my rest of my, so you can feel tired because your blood pressure is too low and your heart's not pumping enough and giving you enough blood flow. I mentioned the dizzy and lightheaded, also nausea, and the heart palpitations we were mentioning earlier is also a side effect of the drug. So it's always problematic when you're taking a drug for something and its side effect is that exact same symptom. That's not what we're going for, right? We really want to get to the root cause, and naturally, if possible. Another side effect of this drug is that it can affect hypoglycemia or low blood sugar, such that the person does not feel the early signs of hypoglycemia, and then they can get very dizzy, lightheaded, even turning into passing out or having a seizure. So this is not all drugs have side effects. Is it considered on the safer side of drugs? It is. It's been out for a long time, but these side effects are real. And what if you just don't need it because there's another root cause? I want to make sure I handled all. The other side effect is sexual dysfunction. So erectile dysfunction, both in men and women, and basically sexual dysfunction. You're not able to perform sexually because that requires decent blood flow. I mentioned nausea. I didn't mention insomnia, so that's another part of it. And trouble sleeping creates a whole host of ill effects in the human body. So it's not without its side effects. Okay, now let's move over to what could it be. When you're having heart palpitations and your heart has been ruled as fine, so you do not have heart disease, you do not have heart failure, but you're having these heart palpitations, we want to look to hiatal hernia syndrome as a root cause because of the fact that what happens with your stomach is that it gets compressed and pressure is put on that. And as that compression happens, the stomach hits into the diaphragm, which is right above the stomach, and right above the diaphragm is the heart. So heart, diaphragm, stomach. So as that stomach pushes up on the diaphragm, that can create shortness of breath and anxiety because you're not getting enough oxygen. Your nervous system knows this and it goes into fight or flight and is making a lot of adrenaline. So then you're put on this drug that lowers your adrenaline. How about we just figure out why your poor diaphragm is not able to move correctly? And that's a natural treatment. And as the diaphragm elevates, it gets in the way of the heart. The heart doesn't like that and it starts palpitating. So this is a scenario that we understand is happening in a lot of people. And again, the beautiful solution is that it's natural. We don't need drugs to fix this. We don't need to have your heart beating slower. Your heart is fine. It's not diseased. It's being aggravated by the fact that the stomach and the diaphragm are getting in its way, and it's reacting to that, which is very understandable. So the root cause here is a digestive issue. And when we get to the reason of why the compression, inflammation is happening, then the stomach relaxes, the diaphragm relaxes, it can freely move again. And then nobody's in the way of the heart, it's in its own happy place, and nobody is impinging upon that, and the heart palpitations cease. So I'm bringing this up because I see so many patients on beta blockers. And my first question is, do you have a heart condition? It's like, no, my heart was checked out. I mean, obviously, first thing I did, had these heart palpitations, ran to the ER, then went to my primary care. My heart was checked out. It was fine. Great. So we know it's not your heart. So why are we putting you on a drug to slow down your heart? Oh, because I was complaining of heart palpitations. Right, but we don't have a diseased heart. So let's figure out why the heart palpitations are happening. And then concurrently with that, again, shortness of breath is common. Also, the anxiety. So you're put on the beta blocker because it lowers the adrenaline level and takes your nervous system out of fight or flight. But I really dislike it when the human body is trying to tell you something, it's going into that fight or flight, and you are a little anxious and you are a little short of breath because your diaphragm it's not stuck, it's moving, but it's not floating the way it should effortlessly. And because of that, your nervous system is telling you something's not right with my diaphragm, and that's why I'm feeling anxious, and that's why I'm feeling short of breath. Instead of coming in there with a sledgehammer, which is the drug, how about we listen to the body and say, okay, body, what's going on? And you handle this pressure that's on the diaphragm, and it starts moving again, because there's nothing wrong with the diaphragm either. But it's like somebody's sitting on your chest, right? And you're breathing just fine, and then somebody sits on your chest, and you just go, wow, maybe I need an inhaler. You don't need an inhaler. You need the guy to stop sitting on your chest. And so that's the difference by getting to the root cause versus managing symptoms with medication. Okay, so if you're in this category of being on this beta blocker, and when you look it over, you don't have heart failure, you don't have high blood pressure. And by the way, I have to interject the fact that root cause medicine, what we do, regularly handles the real root cause of high blood pressure such that we're able to get people off their high blood pressure medication. So that's another thing that would be part of a program if you saw us. But in this particular case, I just heard from a gentleman in England. He's 22 years old. He's only 22 years old. and he's been on a beta blocker, does not have high blood pressure. He has heart palpitations. He's having shortness of breath. And he said, he finds himself sighing. So that's the other thing that happens with shortness of breath. All of a sudden you're like, it's your body trying to get that extra bit of oxygen. So if this is you, if you're on medications like beta blockers that you've always been questioning, I don't really fit into that category. I know it's being treated kind of off-label for me. Let's get to the actual reason why you have these symptoms. Treat them naturally so you don't need medication and you don't have to worry about the dangerous side effects associated with all medication. So that's what root cause medicine is. We'd be delighted to help, and give us a call for a consultation.